Happy Friday, everyone, and welcome back to another episode of NHLN Opinion Plus, a weekly series airing every Friday. This is a space for opinions where we talk about current events and questions the Latino community is curious about. Today, we are joined by local health professionals Dr. Marie Elizabeth Ramas and Dr. Trinidad Tellez on the Lighthouse New Hampshire. Welcome both, and thank you so much for joining us this week.
Hello, thank you.
Thank you for having us.
It's a pleasure to have you both. I was hoping we could start off if you could give us an introduction to the Lighthouse New Hampshire.
Sure. So the Lighthouse New Hampshire was started by myself and Dr. Tellez in December. And we recognized that in the midst of the COVID pandemic and the response, there was a lot of activity coming from the public health departments, from our hospital settings, and from other local area leaders, but there wasn't really a safe space for our Black and Brown community to get trusted information. So we thought we would create a virtual platform for that.
That's amazing. And so maybe if you can give us a bit of your professional background while we're going into this, sort of what did you think about while you were creating this resource for other people? You know, what were some of the key things you wanted to include?
Well, first of all, a lot of our Black and Brown community in New Hampshire and in the United States are frontline workers, and they're frontline workers that don't have the luxury of taking time off or working from home. And so we really felt that it was important that people got accurate information from trusted people that look like them in the state in order to come and get information that they may not feel comfortable asking in other spaces. So with that, we see the Lighthouse New Hampshire page as a place where people can get information where they can readily share with their loved ones as well, both locally and abroad. And also we have developed a monthly Facebook Live event where we talk about important questions. We call it the word on the street. So things that we hear just in our comings and goings, and from people who are interested, they send us questions and concerns. Most recently, we had a word on the street this last Saturday, actually, that was about specifically the COVID-19 vaccine. So, and we hope to have more about that.
That's great to have it be so interactive. Yes, please.
Yeah, and I'll add on and I'll share. So both Dr. Ramas and I are family physicians. Dr. Ramas practices in Nashua and has had a vibrant practice for 10 years. I am a little bit older, and so I practiced and then moved into state government public health work, where I was for the last 10 years. And so really the vision for Lighthouse New Hampshire was Dr. Ramas's, but having been someone who spent a lot of time trying to think about how do we get important health messages out to communities, how do we make sure they're available in other languages, and really this concept of, excuse me, sometimes when we're health professionals, we get used to speaking like the medical jargon language. Right. And some of us, when we're from these communities, we're more used to how do we tell our abuelita something, right? How do we explain these concepts in ways that our neighbors and our friends and our comadres can understand? And so this passion for educating and passion for making things understandable, I think, is something that we both very much relate to. And so it seemed like I was pleased to be able to jump in and partner on this vision and bringing it to reality.
That's great to hear. Yeah, especially the range of expertise you both have, able to bring a balance. That's really nice. The introduction written on the Lighthouse New Hampshire Facebook page mentions culture barriers and historical reasons for hesitancy regarding the healthcare system in communities of color. Could you both kind of tell us a bit more about these issues and how they have impacted people of color's experiences?
Yeah, go ahead, Dr. Zayas.
Dr. Ramos speaks very eloquently about this. I will add, it's interesting, there's been a couple articles I've seen recently that are helping us realize that as much as the media and maybe the academics want to say, well, communities have often been experimented on or neglected care, or there's the very famous Tuskegee syphilis experiment. The reality is there's all sorts of reasons that are very present currently for why our communities maybe mistrust institutions such as healthcare providers, government, and so just the everyday barriers that people face in being able to access care and being able to afford care and being able to be given appropriate treatment or high quality care. So I think it might be a little different for Dr. Ramos and I, because we're both members of our communities, that, native, bilingual, bicultural providers. We are not the norm that our community members who usually get, who treat members from our communities. And so oftentimes there's just not as much of a connection, maybe not as successful experience with trying to seek out healthcare, whether it's because of language access or what we think of as cultural competence or cultural sensitivity or cultural responsiveness, right? So all these reasons for why people currently may not have had the best experiences or may not even be able to be accessing care at all are the current reasons for why people maybe have mistrust, right? People don't really know why they should believe something, especially people who've been having to go in to work, have not been privileged enough to sit at home, as I've been lucky enough to do, right? And work via a computer and not put my life on the line every day. Dr.
Yeah, and I would just add to that, it's hard enough trying to navigate in the system, any system, right? But particularly the healthcare system. And, one of the things that my patients value about our relationship is that I understand them. They feel like they're understood. And without that level of person-to-person trust, it's really hard to go into a situation, particularly like COVID, and not really understand everything. Lots of things are happening at the same time. And then again, have to take a step of faith, so to speak, without feeling like you have a safety net. So hopefully the Lighthouse New Hampshire can be that net, can be that place where we can all convene and we can come together as a community, because that's what's important to many Black and Brown communities. Yeah.
Great. Thank you. That was such a great way of putting it. Thank you for that explanation. And as we know, of course, the pandemic has disproportionately affected people of color, as we can't really not talk about it, especially on our series here. Every week I'm talking about it. But the Mayo Clinic has reported that COVID-19 hospitalization rates among non-Hispanic Black people and Hispanic or Latino people are around 4.7 times the rate of non-Hispanic white people. What might be some reasons for this? Why might people of color be more vulnerable for contracting the virus?
Yeah, I'm just going to share a story with you. And I think that this is pretty typical as far as my interactions and a lot of my colleagues. So I was doing a triage call. I was doing a call. My patient called in. They weren't feeling great. One of their family members, they work construction. And so they came home. They had sniffles about a week before, and then they called. And this person happened to be a little bit older. They were working as a housekeeper, and they were one of the only incomes in the household and taking care of several people. And the person calls, can barely finish their sentence. Dr. Ramos, can you send me something to help with my breathing? I think I just have bronchitis. And I'm like, well, I don't, you can't really say that right now. We have to get a COVID test. I don't have time to be sick with COVID. And if I have COVID, that means I can't work. If I don't work, I can't pay my bills. Can you just give me something to get through, right? So this is very typical from my experience anecdotally, that part of the reason why people are getting hospitalized more is partly because they are getting admitted in a much more severe state. And so they're not being caught early enough. There's a colleague of mine who's a family doctor. Her name is Suzanne Moore, and she unfortunately died from COVID. She lived in Indiana, has a son. And she actually went to the hospital as a woman of color, as a Black woman, went to the hospital with signs of COVID, could not breathe, was sent home with low oxygen levels, and went back into the hospital into a different hospital facility because she wasn't getting the care she needed. And unfortunately, throughout her hospital stay, she continued to try to advocate for herself, and that led to her demise still. And so it's complicated. We have individual choices, but we also have a biased system.
Right. Absolutely. That was a great story to really explain that. Thank you. Do you have anything to add?
Well, I think it gets complicated because early on we heard, well, people who are older, people with multiple medical conditions, and oftentimes our community members do have more medical conditions that are uncontrolled because of this lack of access to healthcare, whether it's because they're too busy, they maybe work jobs that don't offer health insurance, or the health insurance is just something they can't afford to uptake. And so there's so many complicating, superimposing reasons. And part of it is also blatantly racism, right? We have learned increasingly over time how the stress of being a person of color in this society, the United States, puts undue stress on our bodies and actually manifests physically as just us having more biologic manifestations, in having worse rates of many chronic conditions. That then means that if we get exposed, and we're more likely to be exposed if we're the ones who are out there on the front lines working in the jobs that require people to show up, or maybe because rents are so high and because pay is so low, a lot of us live in combined housing, right? Where maybe there's more people sharing, trying to afford the rent in a unit. And also our families tend to be more like familial, right? Intergenerational. And so for whatever reason, maybe there's more people in a housing unit. And so if more people are at risk of being exposed through work, and then there's more of us together, it makes it harder to physically distance and do what you need to do to try to protect each other. So there's many, many different factors for why it's all, we're calling it a tsunami, right? Seeing this effect of the underlying inequities that were already there now being just totally, laid bare to see by COVID.
Okay, thank you for that response. Yeah, I already imagine that it's complicated, but you have to think about how these different factors interact with each other. And right, some of them are kind of on the surface and some of them are more systematic. Wow. We're kind of running out of time almost, but I want to get into the ocean of misinformation on the internet about COVID-19 and its vaccine, how it's repeatedly finding its way through communities of color. I'm kind of curious about why might that be, and especially why is it? What kind of damage can this misinformation regarding the vaccine? What kind of damage can it make within these communities of color?
I'm really glad you mentioned that. And then, the anti-vax movement is being very targeted actually to communities of color. They're actually putting out on a regular basis information on Twitter, on Facebook, targeting Black and Brown people. And, why are they doing that? I can't say, right? Why would we want to affect those who are most vulnerable? But what I do know is that we need to make sure that we are putting out accurate information, counter information by people that are trusted by the community. And that is the message that both Dr. Tellez and myself want to make sure that people understand. Not everything you're exposed to is legit. And so make sure that you're validating your information by vetted sources that you trust.
Yeah, I'll say that already, in the last 10 or 20 years of the internet, it was already a well-established fact that a lot of the information is inaccurate or completely false and misleading, right? It's just worse now. And it's hard to know who to trust. So as a family doc, I always recommend medlineplus.gov as a source of reliable information from trustworthy sources. And then when we do our Word on the Street episodes, we do make a point of sharing a few resources that we think are topical, readily understandable, as much as possible, from sources that we think people should be able to understand and trust. And that's just the two of us are just as volunteers trying to do what we can as best we can to try to make connections, point people to resources, make people aware, and just have a place for people to share and dialogue. And hopefully more people will join us.
Yeah, and that's what our community does. Our community is really great at coming together and making things work for our community. And we are just extending that into this current pandemic that we're in.
Right. That's great to see, for it to survive through this. Yeah. Or not even survive, but grow because of the necessity of that community and education. So before we go, it's been so lovely talking to you both. Are there any resources or sort of reminders you want to share with our audience, along with maybe other ways they can interact with the Lighthouse New Hampshire, things they can look out for?
Yeah, definitely. You know, first and foremost, get vaccinated. New Hampshire, there are resources, call your local health department to find out ways that you can get vaccinated. You don't have to be 100% sure, but if I were to take my chances between getting sick with COVID and possible, you know, whatever fears I have about the vaccine, I'm going to put my chances on the vaccine, because we're trying to save lives, and we know for sure that the vaccine saves lives.
Thank you.
Yeah, and visit the Lighthouse NH and join us for Word on the Street, or watch the recording afterwards.
It's very excited. I'm excited to stay updated with your work. Thank you again, both, talking with us, Dr. Ramos and Dr. Tellez, for being our guests on NHLN Opinion Plus this week.
Thank you for having me.
It's been a pleasure. Please take care. Everyone, please tune in next week for another episode. Follow us on Twitter at NH Latino News and Instagram at NH_Latino News. I'm Belen Dumont with NHLN Opinion Plus, and I will see you all next time. Bye.